But I guess one of the questions that comes to mind is, couldn't CADTH do it? What is it beyond the current remit that now needs to be layered on top or be added to really make something like National Pharmacare a reality? What are the key issues that still need to be addressed by a CDA going forward for us to be able to successfully implement something like that?
Sammy, why don't you start and then I'll jump in.
I think if you look at sort of the current discussions around sort of mandates of what CDA is going to be, it has a lot to do with data, right? It has a lot to do with increasing pan-Canadian data collection and expanding access to the drug and treatment data. And that's really important because if you think about Canada, and again, like you're talking about National Pharmacare, which we don't have, and the reason why we have that discussion is because Canada has very fragmented drug insurance or drug coverage, right? And so every province has its own drug programs, but then also quite a lot of us are covered by private payers. And there's a myriad of different types of coverage plans, right, with the private payers. So data around, how a drug is utilized, how it's prescribed, and just even understanding, after the drug is even covered by insurers or drug programs, how that sort of utilization looks like, and is it appropriate, is it not? All of those kind of information is very hard to access, sort of at a national level, right? And so I think that's one of the key in terms of CDA sort of remit is like you want to be able to have a much better understanding of data, right? And that will actually help inform not just sort of safe and effective use and appropriate use of drugs, but going back to my former life at the PCPA, right? You can then have better sort of understanding of the data and the infrastructure that can be used to potentially think about pricing or negotiation based on performance or outcomes. And you could potentially have a system where, we are going to be able to do a little bit more of paying for an actual sort of, clinical outcomes or performance and that kind of thing, right? So for me, I think it is, I love the fact that I'm seeing that there is a more push towards that collection and utilization of real world evidence.
Yeah, and just to go back to your question, Costas, about what does the Canadian Drug Agency need to do, I think we need to take that up a level first. Is what is the Canadian government on behalf of the people of Canada need to do? Number one, they need to make a decision. Is this going to be a single payer, public, first dollar coverage type of a pharmacare program? Or is it a program that's going to fill the gaps and ensure that every Canadian has adequate access to pharmaceuticals without undue financial risks? So to me, that is probably the most important aspect that our government still needs to make. And then the Canadian Drug Agency will roll out the programs to help manage that system, whatever that system needs to be, as well as all of the provincial governments, the health ministries, and pharmacy drug plan officials across the country. The CDA will be managed by both the federal, provincial, and territorial governments. There'll be a board of directors, all kinds of things that they'll be asked to do. Probably one of the first things, and they've already started doing that, is to help develop some form of a national formulary of drugs that all provinces will buy into, whether that's through an essential medicines list or a tiered formulary aspect. Those are some of the things that I think the CDA under Suzanne McGurn's leadership will continue to seek that direction both from her board and from the various levels of government. And to bring it back to the RWE, I think this will also give CADTH the opportunity to continue to roll out and expand their post-market drug evaluation program that Terry Ahuja has been pushing forward.
Yeah, and we're part of that program through the CoLab group as well. So we've seen it firsthand, and I think, Sangmi, to your point, that ability to have line of sight to the actual utilization as opposed to seeing a fraction of the utilization here or utilization in certain populations but not in others, it certainly would change fundamentally the landscape of what type of negotiations or what type of contracts can be put into place.